Hi friends, we will discuss about the movements of inversion and eversion. So these movements they take place in the foot. So we will study about the movements, the joints at which they take place and the muscles that are responsible for these movements. Let us see a clinical case scenario and then see whether you will be able to answer this question. A person comes to the OPD with a complaint of difficulty in eversion of foot and loss of sensation on dorsum of foot. Which of the following nerve is involved and give explanation? So there are four options. One is the superficial peroneal nerve, then deep peroneal nerve, saphenous nerve and sural nerve. So we will answer this MCQ at the end of this session. Now let us discuss about the movement of inversion of foot. We are looking at the picture. Concentrate on the picture and look at the foot. So this is the dorsum of foot. The other is the sole of foot. So in the inversion movement, the foot is tilted in such a way that the sole of the foot is towards the midline and the medial border, this is the medial border of foot, is raised, the great toe is raised and the dorsum of the foot faces laterally. It's facing laterally and that is called the supination of foot. Then the foot is moving medially. It has moved medially and the toes point inwards. That is called the adduction of foot. There is associated plantar flexion of the foot, so which takes place at the ankle joint. So this is how we describe the movement of inversion of foot. Then what are the muscles that are responsible for the movement of inversion of foot? So they are the tibialis anterior and tibialis posterior muscles, because both of these muscles they have attachments to the medial border of foot. The tibialis anterior is inserted into the base of first metatarsal and the first cuneiform, that is the medial cuneiform, whereas the tibialis posterior is inserted into the navicular bone. So whenever these muscles contract, it will raise the medial border of foot. Apart from, they also help in maintaining the medial longitudinal arch of the foot. So that is the explanation we can give for the inversion of foot. We have used the words supination, adduction, plantar flexion and inversion while describing the movement of inversion. So what is supination, which you will describe in the case of forearm? Here supination in foot, it means the adduction, the plantar flexion and inversion. So that is supination in the foot. So the three components of supination in the foot. Hope the movement of inversion is clear to you. After learning about the movement of inversion, let us see what happens in the eversion of foot. See the picture. See how the sole is facing. In the previous you have seen the sole facing medially towards the midline. Now see in the movement of eversion, the sole of foot is away from the midline of the body and lateral border of the foot is raised. the little toe is raised. The sole is facing laterally. That's called the pronation of foot. And the toes are pointing outwards. It is called the abduction of the foot. And there is associated dorsiflexion. Then what are the muscles that are responsible for the movement of eversion? They are the peroneal muscles. Recollect, what are the peroneal muscles? So these are all the muscles on the lateral compartment of leg. So what are the peroneal muscles? Peroneus longus, peroneus brevis and peroneus tertius. These three are the muscles. And when these muscles, they shorten, they will be pulling the lateral bones of foot. So what are those lateral bones? They are the fourth and fifth metatarsals. That's how they avert the foot. So now you know about the movement. So where the sole of the foot is away from midline, raised lateral border of foot and little toe, then sole facing laterally, which you call it as the pronation of foot. Toes pointing outwards, which we call it as the abduction of foot. Then the associated dorsiflexion. Now let us see what is pronation in the case of foot. So the pronation is equal to abduction of foot. Yes. Then the dorsiflexion of foot and eversion of foot. Hope it is clear to you about the eversion of foot. Now let us go into some more details of the inversion and eversion movements of the foot. So I have presented it in a table. So how to define the movements of inversion and eversion? The simple definition is raising the medial border of foot and sole facing medially is inversion. Raising the lateral border of foot and the sole facing laterally is eversion. You can see this picture of sole facing medially and then sole facing laterally. That is the movements of inversion and eversion. Then what are the associated movements? Now you can answer. That is the plantar flexion in inversion and dorsiflexion in eversion. Then we have learnt about the muscles producing the movements. Now we will add the nerve that is supplying them. There is the tibialis anterior and tibialis posterior for inversion movement. Tibialis anterior is supplied by deep peroneal nerve and tibialis posterior by the tibial nerve. Then regarding the eversion movements, the peroneal muscles. Okay. So these are all the muscles that you are having the letter E as the second letter in their name. So see the peroneus E. Peroneus longus, which is supplied by superficial peroneal nerve, and peroneus brevis supplied by superficial peroneal nerve. Then the peroneus tertius supplied by deep peroneal nerve. So now you know about the muscles and their nerve supply. And the movement of inversion and eversion of foot, whether they are taking place with the foot on the ground or off the ground. Try in your own foot. So whether you are able to do the inversion movement with the foot on the ground or with the foot off the ground. So if the movements are taking place with the foot on the ground, these movements are restricted movements. And when the foot is off the ground, so the range of movements is greater. Try it for yourself. Then you will appreciate it. Then what are the joints where these movements of inversion and eversion of foot are taking place? They are the subtalar joint or talocalcaneal joint and talocalcaneo-navicular joint. Now after learning about the details of the movements of inversion and eversion of the foot, which are composite movements, and the purpose of which is for adjusting the foot while walking on uneven surfaces and sloping surfaces. So now you have understood about the importance of the movement of inversion and eversion. This will be helping you in answering the MCQ questions in the examination, or you may get it as a short note question. Now let us answer the first question with which we have started our discussion on inversion and eversion of foot. A person came with a complaint of difficulty in eversion of foot and loss of sensation on dorsum of foot. Which of the following nerve is involved, and give explanation. So for this, the explanation at this stage which you can give. So let us see the order. So there is the superficial peroneal nerve, the deep peroneal nerve, saphenous nerve and sural nerve. So the answer is superficial peroneal nerve. Why? Because what are the muscles that produce the eversion of foot? So what are those muscles? The peroneal muscles, and of which the superficial peroneal nerve is supplying these muscles, especially the peroneus longus and brevis. These are the main muscles, and which are supplied by the superficial peroneal nerve. And then there is loss of sensation on the dorsum of the foot. So if you read about the innervation of the dorsum of foot, the major component is by the superficial peroneal nerve. So there is loss of sensation on the dorsum of foot. So the difficulty in eversion. So if you combine these two, the right answer is the superficial peroneal nerve. Hope it is clear to you about this question. Now let us see another MCQ, whether you will be able to answer. A jogger sprained his ankle. While jogging, he has sprained his ankle, and there is injury to the ligaments on the medial side. And what type of sprain it is? There is a one. So you have to revise the ligaments on the medial side of ankle. Then, is it an inversion sprain, eversion sprain, dorsiflexion sprain, plantar flexion sprain? What was the answer? It's a eversion sprain. So ligaments on the medial side of the ankle, they can be put to sprain whenever there is eversion of the foot. Okay, they will be put to sprain when it is everted, when the foot is everted. So the right answer is the eversion sprain. Easy for you to understand and answer this question. So inversion and eversion movements. So again see the pictures for understanding the inversion and eversion movements. So in which joint they take place? Is it inferior tibiofibular, ankle, subtalar, calcaneocuboid? Which is the joint? So the right answer is subtalar joint. Hope it is clear to you. Now let us see one more MCQ. A patient is unable to invert the foot. Previously has seen eversion defect. Invert the foot, indicating lesion of which of the following nerves? So you have to think of the muscles that are causing inversion and their nerve supply. Superficial and deep peroneal nerves, deep peroneal and tibial nerves, superficial, peroneal and tibial nerves, the medial and lateral plantar nerves. So which nerve is the correct answer? So the correct answer is the deep peroneal and tibial nerves, because the tibialis anterior and tibialis posterior are the muscles concerned with the movement of inversion. Deperoneal is supplying the tibialis anterior and tibialis posterior is supplied by the tibial nerve. Now let us see the last MCQ and close this topic. Which of the following muscles does not participate in eversion of foot? So think of the muscles that cause inversion and eversion. So which of the muscles among the four of the following is not participating? Peroneus brevis, peroneus longus, peroneus tertius, tibialis anterior. So which one is not participating? All those starting with the letter E will be as the second letter or concerned with eversion. Then the fourth one, this one, tibialis anterior, which is concerned with inversion. So that is the right answer. Hope you have understood about the movements of inversion and eversion of the foot, the muscles producing the joint responsible, and what are all the events that take place in these movements.